And good morning, it's August 9th, 2023. I'm Dr. Deuk and I'm here with a patient who's traveled from northern Florida. I'll say Madison. At first I thought it was Madison, Wisconsin, but it's Florida. She's got a smile on her face today. Why are you smiling?
Because I feel so much better than when I came in yesterday.
And what did you come in yesterday to Deuk Spine with? What kind of problem?
Right sciatic pain that radiated all the way down to my foot, and some back pain on kind of the mid to right side.
And we tested those L4-5, L5-S1 discs during surgery. They were very painful for you, which tells me you were probably like guarding and not doing a whole lot of activities just to protect them and not make them act up. But it was the sciatic pain that drove you here, huh?
Definitely.
And you came with some family members.
Yes, my loving parents.
I had the pleasure of meeting your parents. They're lovely people. So supportive. You're lucky, to have them. So tell us about your life before you had your back fixed here at Deuk Spine with the Deuk laser disc repair. What was life like for you?
It was miserable. To backtrack a little bit, make it long story short, I had back pain most of my adult years, but stuff that went away with like over-the-counter things. I've been a nurse for 5 years. I traveled for the last two and a half years. The last year, my back pain started to become sciatic pain. I fell off a ladder in January this year, 2023. It went all the way down to my foot to the point where I lost my job for the last 3 months, but I've been in pain since January.
Yeah, and so you tried some shots. We tried an epidural. Didn't work too well for you.
Not at all.
And how did you find Deuk Spine Institute?
With the Lord's help, really.
Amen.
A lot of Googling, a lot of research for myself, taking proactive care for myself, and not just relying on what protocol and status quo is for back pain, just really putting myself first and not settling with what everybody else is doing. As a nurse, I've met a lot of patients who have chronic back pain. And I knew I didn't want the normal surgery, and I researched to see if I can find somebody who dared to do something slightly different or more different than anybody else, can critically think for himself, and was actually practicing it, and that's how I found.
Well, thank you. It took me a few years to figure it out myself, because it's so ingrained in our training and residency that, oh, you do this surgery, you do a fusion, you do artificial disc, that's it, right? Or microdiscectomy, but then patients always come back and get fusions later. So I started to really question, are we doing the right thing? Is there a better way to do this? And when I saw, and it was Dr. Parvis Camben, he was an orthopedic surgeon up in Pittsburgh. And he pioneered a new technology of coming from the side of the spine rather than going through all the bones and ligaments and removing them. And his way at first wasn't great. He had a lot of complications, but over the years, his students made his technique better. Those students taught me. And so I'm what do you call it, second generation, I guess, endoscopic transforaminal surgeon. And we've been doing it here at Deuk Spine for 16 years. We've done over 1,600 surgeries. Patients do fantastic. It's a one and done. I don't expect you to need to come back. You can see in your surgery video that we were in those discs. We tested them. They were very painful for you. And then I used the laser to clean out the tear and remove all the pieces of herniation. There are quite a bit of them. Looks like it had been there for a while.
Oh, yeah.
Yeah, how long have you had the back pain? When did it start?
I noticed something was wrong about February of last year, when the pain got a lot worse, and Motrin and Tylenol was just not helping at all. Foam rolling only did so much for me, to the point where I had to come off the road, go see chiropractor after chiropractor, which they helped, but it never lasted.
Never fixed the problem.
So I figured, okay, it's not really an alignment thing, something else is wrong. And once the tingling got to the toes, I realized, oh, okay, it might be a nerve thing.
And it's sad that you lost your job due to your back problem. People shouldn't have to lose their jobs. They should be able to get this surgery done, move on with life, and put it behind them. That's what we're trying to do.
Thank you.
You're welcome. Anything else you want to say to your fans out there? Your brother.
To everybody, take care of your body, and if you don't know what to do, find somebody who knows what to do and who you see eye to eye with, and they speak your language. They'll come down to your educational level and help you step by step to get better.
Congratulations.
Thank you, sir.
All right. Safe travels back home.
Thank you.